Thank you, Dr. Scott. I just wanted to go back to Dr. Chan for some clarification on the data and the vaccine. Could you please state again for the record how safe the vaccine is?
For the record,
yeah.
For the record, the vaccines are incredibly safe. There are some rare adverse events that have popped up. They've been recognized by the FDA. They're very rare. The vaccines are safe and effective.
Thank you. With that, I'll open up for some questions before we move on. Representative Messier.
Good afternoon. I just have a question about those people that are in the hospital now with the COVID. Are they all unvaccinated people? Or, 'cause I think people are confused about that.
What we know for sure is the vaccines are not only safe, but they are extremely effective, keeping people alive and keeping people out of the hospital. Those who are in the hospital now have a 3 to 5 times higher chance of being unvaccinated. So the vaccine does work extremely well in making it so that the majority of the people over time that are actually hospitalized are people who have not gotten vaccinated yet and are putting themselves at a significantly higher risk of being hospitalized or, unfortunately, of dying. I often look at it as if you have a loved one and you want them to stay alive and you would give them any tool you can to help make that be possible, what we've seen from the data is there's an over 90% chance, if you make sure that they are vaccinated, staying alive, even if they are infected with COVID-19, is significantly higher. The same for vaccination. And really making sure that your loved ones have that kind of tool is what we want to get the message out from a public health standpoint.
And so those people who are vaccinated, and you said it's highly effective, what are the percentages that they would still pass it to someone else?
So we do know that the vaccine protects highly against hospitalization and severe disease. There is still a small chance that someone can be infected and potentially pass it along. We don't know the exact numbers there. It varies by study. It does appear, though, that high 80+% the vaccine is going to protect you just against being infected, and then high 90s in terms of preventing hospitalizations and deaths. I will share one quick story, though. I had a patient last week who's immunocompromised. She's in her late 20s, immunocompromised. She's an autoimmune disease. She takes some immunosuppressives. She'd gotten 3 doses of the Pfizer vaccine. So she had gone the regular dosing regimen as well as boosters, and she still got COVID. Now, luckily, she was able to get monoclonal antibodies, but this just points really to the need that the rest of us need to get vaccinated, is to protect the subset of people that are immunocompromised, even who are getting vaccinated. And the vaccine is a little bit less likely to provide full protection in those that are immunocompromised, which is why they need a booster shot. But even then, they can still potentially get COVID. So this just really speaks to the fact that for those of us that have normal, healthy immune systems, all of us need to get vaccinated to do our part.
Representative McGuire.
Thank you so much for being here and for your presentation. I really appreciate it. I was hoping you could talk a little bit about the relationship between low vaccination rates and the development of new variants.
I didn't catch the last part, low vaccination rates.
And the development of new potential variants.
New variants.
Going forward.
This is the biggest unknown, in my opinion, the pandemic and where we're going. There's a variant called the Mu variant, MU, that has been reported in the media, something that we're watching closely. There is the potential for new variants to emerge that are going to be resistant to vaccines. Now, we all have our fingers crossed. We have not seen it yet. We've also seen in areas where some of these other strains have come and the Delta variant is prevalent, is that the Delta variant is so infectious and contagious that it overwhelms other variants. And the vaccines are effective against the Delta variant. And this is why we need to really get a handle on this now. We really need to all get vaccinated. We need to, stamp out this virus now so that new variants don't emerge. And the vaccines will also prevent and help. right? So variants emerge when there's ongoing replication and transmission in the community. So if we suppress that with vaccinations, we'll also help prevent the emergence of new variants.
And I'll just add to your point of the question, it's why it's so critical for us to get our vaccination rates as high as possible. It's not only for protection right now, but it will protect us as a society, as a state, from the future in whatever other kind of variants come, particularly if the vaccine is less effective of them in the future. If we have 95% of our population vaccinated, it puts us in a much better position to fight against those other future variants. And getting those rates up here in Rhode Island, we have a head start. We want these policies to help advance that, and all of you to help and do that, help us in doing that. We also know that it's critical throughout our entire country to help achieve that, because places where the vaccination rates are lower increase the risk of immune escape and new variants coming into place that are make the vaccine not as effective. But we can prevent that if we really push on what we're doing now. Thank you.
Representative Chippendale.
Thank you, Chairman. And thank you, everyone, for appearing today and for testifying. First, I would be remiss if I didn't thank Neil and the team for providing data when asked. He's been extremely helpful, as has the entire team, in providing data in what I know is a very hectic time in your world. So thank you for that. One of the things that I was particularly interested in and trying to just understand a little bit better to see if it matches what we are getting for anecdotal information, whether it's from folks in hospitals or medical staff or whatever, was the demographic breakdown. And I'm going to put you on the spot, Dr. Chan, because Neil said that you guys are doing some studies, particularly with Brown, more on that granular level where you're looking at these types of things. So when we consider the folks who are being hospitalized, that's one group, right? We have the contracted group, we have the hospitalized group, and we have, unfortunately, the death rate. And so those are the three areas that Neil has been providing me information on. What's not in there and what's not collected by health is, are we dealing with primarily folks who are morbidly obese, diabetes, immunocompromised? Are those the folks predominantly being hospitalized, of those being hospitalized? And are those, regrettably, the folks who are dying of those that are dying, and, you know, advanced aged, all of those things that we know and we've come to accept are risk enhancers, if you will. Do you have, even if it's just a sort of roundabout estimate based on what you've been observing, do you have any way to articulate what that demographic breakdown is in hospitalizations and deaths?
Yeah, thank you. It's a great question, and I will say we have looked at this in depth, and it is exactly the populations that you state. So age is really the biggest risk factor for significant disease, so the older you are, for sure. And then, as you mentioned, obesity, being immunocompromised, and just having any other comorbid health condition really puts you at greater risk of dying from COVID. Not just getting COVID and having severe complications, but of course dying. It just complicates the whole picture.
So, and I think we kind of expected that, right, that from the data that we had. So one of the things that I had mentioned, I think it was one of our first, and it was, of course, a Zoom task force meeting, that I just questioned. It was more or less a question, and I'm questioning it today. Why aren't we doing more to, in addition to beating the drum, quote, it works and it's safe, quote, we need to push the vaccine as much as we can. In addition to that, why aren't we just continuing to raise that awareness? Get off the couch, do some exercise, go outside, get vitamin D from the sun, stop smoking. We can be doing that at the same time as we're twisting people's arms about getting vaccinated, and I think that may provide a greater service to those folks who are most susceptible to hospitalization and death. That's an observation. I would love to hear whether or not you agree with that observation.
Absolutely. That's core to our public health work, and I can certainly say with confidence that our folks on the team at Rhode have been continuing that as full court press, that all of the preventative approaches, exercise, nutrition, wellness, work-life balance, vaccinations, all of these are key to prevention and making sure that people have access to the longest lives they can live. And our push is also making sure every community has the opportunity to do that as well, regardless of the zip code that they're from.
So when you say your push, certainly I see whether I'm listening to Spotify or I have the radio on or I have the TV on or I'll open up the newspaper, I'm seeing a very concerted effort to say, get vaccinated, wear your mask. Maybe I'm missing it. Where are we advertising and encouraging people to get healthy and stop doing the things that are making them more at risk for death?
It's happening in multiple ways, all part of just our public health approach. Right now, certainly the ones that are most prominent are the COVID-related ones, but we're still engaging with our providers, we're engaging with community-based organizations and having those conversations. We're supporting all kinds of activities that support it with diabetes, obesity, nutrition, working throughout the communities and really helping to assess at the community-based level what interventions are going to be most effective. And we'll, take that. I certainly haven't mentioned it to the same extent at a press conference, but it is something that is critical, and we can incorporate that into how we're continuing to get the message out.
I think that does make sense to do, and I think we could place a greater emphasis on that and perhaps invest a lot more messaging in that aspect.
Thank you,
Are there-
Representative Chippendale. Representative Place.
Thank you, Mr. Chairman. I've got two general areas of questioning. Do you want me to take them all at once, or do you want me to yield the floor back for other members before?
Let's do the one so we can get everybody in.
Okay, thank you.
And then we'll come back to you.
So, going back to Representative Messier's question, out of the hospitalizations, because I didn't hear an answer to her question. Her question was, out of those folks that are hospitalized, how many of those are vaccinated? How many of those are unvaccinated? So in my mind, that's a continuation of her question, because I don't think that question was actually answered. So do you know the actual numbers, the percentages in terms of hospitalizations and those that have been vaccinated, those that have not been vaccinated?
We absolutely have that data. This is just cases, it's not hospitalizations. But the key is knowing that it evolves over time. So prior to the Delta strain really accelerating in July, the majority of people who were hospitalized were unvaccinated. You may recall CNN had published in the middle of the summer, 99% of people who are hospitalized right now are unvaccinated. So that's a critical answer. With the Delta strain, because of its significant transmissibility, instead of one person infecting 1 to 2 people, one person can infect 6, 7, or 8 people. You see an increase in cases across the board, as well as hospitalizations.
Doctor, I understand. I do. Trust me, I understand it.
But that
it was the
increases
simple
more
question that was asked.
among
But I just,
To finish, please,
I
Representative, please.
understand how you come across. I understand where you're going with this. I understand all of it, and a lot of people do. But where people come into a situation, they start to doubt it's a simple question. We're just asking a simple question, and if you answer it and we go on with it, then we can move on with the hearing. But it's a simple question. I mean, out of the people that are hospitalized with or for COVID, what percentage have been vaccinated, what percentage haven't? You said 99% for CNN reported 99%. Well, Rhode Islanders would like to know, in Rhode Island, out of those that have been hospitalized, what number have been vaccinated, or percentage, whichever you prefer, have been vaccinated or have not been vaccinated?
Dr. Scott, some decorum here. Allow the person who is speaking to finish their chain of thought. We're not going to overtalk anyone in the room. You'll get your questions answered according to fashion. Please understand that. There are a lot of people who want their questions answered, and we owe it to them to finish their chain of thought prior to us butting in and ruining their chain of thought. So please understand that, Representative. Dr. Scott.
Yeah, thank you, Rep, and thank you, Chairman. Rep, in slide 36, it's not hospitalizations, but it's a slide in the appendix that has case rates by vaccination status. I know you're looking for hospitalizations. That's some of the data we've actually been working with Representative Chippendale to get, and I'm happy to forward it to you right after this. It's not in a percentage-wise, but we can make that happen pretty quickly.
And we have it. I just don't have it in front of me right now, and I'm telling you that with the Delta variant, we have an acceleration of people who are hospitalized. The majority of them are unvaccinated. That's the final answer. The majority of people who are hospitalized are unvaccinated.
Okay, now, again, there's been some going back, continuing along with the hospitalizations, and then I'll yield my time back for other members. When we're talking about hospitalizations with COVID, COVID-related, or for COVID, can you differentiate between those numbers in terms of, if someone came to the hospital, they tested positive, so they're in the hospital positively tested for COVID, versus actually in the hospital because of COVID, i.e. they're symptomatic and the COVID itself is actually is the actual reason for the hospitalization, as opposed to we just found out that they have COVID because they were coming to the hospital for something else. Are we breaking that data out with this at all?
Yes, we are. And we have data that shows over 90% of the people who are hospitalized have it's because of COVID. The with COVID number is extremely small. That's someone unfortunately gets hit by a bus, is hospitalized with something related to that, and they're tested and they find out that they also have COVID, but that there was no reason for them to go into the hospital with it. The because of COVID is the majority. Well over 90% are in the hospital. And hospitals, the systems, for them it doesn't matter, because regardless, once people are there with a COVID-associated illness, it costs, it takes up the resources, it requires infection control, all the same steps occur. So we don't get into the specifics because no matter what, the outcome is still the same, but well over 90% are in the hospital because of COVID. Anything you want to add?
Thank you, Representative. The question has been answered, and you have the data that you can supply to the representative. That is correct. Representative McAtee.
Thank you, Chairman, and thank you all for being here. It's great to see you again, in person. The questions I've been getting, and I hope I'm not repeating because I was out of the room for a little while, are about the booster. Obviously, you've mentioned that it's 65 and older and those who are compromised. One of the questions is, how many months after the second dose should people get vaccinated? And do they need to get the same brand of vaccination that they originally got? And where do they go to get it? So, and is it already implemented? I hear some people are saying they've already gotten them, but the majority of people who are just over 65, not compromised, really don't know where they go next. So if you could answer that, thanks.
Yeah, it's a great question. So there's good data now that giving that booster shot for certain people really does lead to a better immune response and more protection. So at the current time, what is recommended and authorized is that for people who are moderately or severely immunocompromised, is they should get that booster shot. For people that have had the Moderna or the Pfizer vaccine, they should get that booster shot, that third shot, about a month after their second shot. For the Johnson & Johnson vaccine, we're still not sure yet. We're still waiting for some guidance by the CDC, by the FDA, on how to deal with booster shots and people that got the Johnson & Johnson vaccine. And we're also waiting for people that are 65 and older, and potentially for healthcare workers, we're waiting to hear about official recommendations from booster shots there.
And it should be the same brand, is that what you said?
Should be the same brand at this time, yes.
All right, thank you very much. And is there any data on whether or not people get the same reaction as they did to the other shots? Is that to be expected?
There is some emerging data on that, and it is expected the exact same reactions. There's nothing else that's shown up. There's no other signals that have come up in terms of safety and getting booster shots. Same reactions that one may have gotten the first or the second shot.
And where are they, did you say where they're giving them at this point, or aren't we doing that yet?
Yep. State sites, any sites where vaccines are being
Yes,
administered.
all of those
Yep,
places?
all those
Okay,
sites.
thank you.
Thank you, Representative McGaugh, and I'm going to ask you to limit, because we have Dr. Fine, and they'll be here after to answer other questions after we get Dr. Fine, but you have a question.
Yes, thank you. My question is around, it's sort of a two-parter, but I will try to keep it brief. But it's around people who get their vaccination out of state. There were reports in the district that I represent in Tiverton and Little Compton about low vaccination rates. And there was some question among the community about whether or not those numbers included if people got their vaccinations out of state, so if they crossed the line into Fall River and got a vaccination, or if they were in Florida and got their vaccination and flew back. So the first part of my question is, how does the Department of Health gather that information, and is all of that part of the numerics that we're working with? And the second part is, for those communities where the vaccination rates are lower than in other parts of the state, what is the Department of Health doing to help those communities increase their vaccination rates?
It took time early on in the response, but we've been able to get information from our neighboring states, such that if you see on the appendix slide 35, we are able to break down vaccination based on Rhode Islanders vaccinated anywhere, compared to all of the vaccinations administered within Rhode Island, to help be able to differentiate. So now, when we are reporting, it is taking into account if you've been vaccinated in a neighboring state, as long as you are a Rhode Islander. For what we are doing, there's an entire amazing team of people that are working diligently, community by community, to ensure that vaccination rates are addressed. We have our overall vaccination campaign that I shared of phase 4, which really focuses on policies and helping to make it a norm and part of the culture to get vaccinated for working in a healthcare setting or in a school setting. We're encouraging all businesses to require vaccination. Many people who were kind of on the fence say they then changed over to get vaccinated once it was, asked of them in their work setting. And those are the age groups, working age populations, where our vaccination rates have room for improvement. So that's how our policies are really focusing in on those approaches. We also have a massive program of pop-up clinics that are in place, doing assessments at the community level to see what locations work well, whether places of worship or community stores or other pharmacies, but really an all hands on deck approach that now has been expanded to include the policies of building on what we were doing with phase 3, which is meeting people where they are and working particularly in the areas with the lower vaccination rates on implementing whatever strategy worked tailored to that community to get those rates up. And a big part of it is this messaging. It's people, individuals talking to their loved ones, hearing this message, going ahead and getting vaccinated, and then talking to your loved one, talking to your coworker, talking to who you go to a place of worship with and saying, it was fine, I did it, I'm actually more comfortable because I know now that my risk of being hospitalized or dying significantly decreases now that I've been vaccinated. Getting that message out is how we're going to get individual by individual to get our statewide rates up as high as we can go.
Thank you. Rep. Chippendale, before we move on.
Thank you, Thank you, Chairman. So one of the, in one of the slides, it was stated that if patient outcome is at risk, they'll be forced to create a corrective action plan. That's what I think we were talking about within the various institutions. It was just coincidental when I was going through my mail on my desk today that I have a letter from the Rhode Island Partnership for Home Care, and they state fairly authoritatively that they're dealing with approximately a 1/3 drop in paraprofessionals in their field and 10% fewer nurses. Now, that's certainly just one of the elements that you guys had listed, but I think we all recognize that there is, there has been some people leaving. Maybe they were close to retirement, maybe they're burnt out from the last 18 months, who could blame them? And then some are leaving because they just don't want to face the deadline and have to deal with it at that point. And I think we all recognize that that will bump a little bit once we get to the deadline. So as far as patient outcomes, I think we also all recognize that a lot of folks have, over the past 18 months, they've skipped their screenings for really preventable and treatable things such as colon cancer, breast cancer, mammographies, colonoscopies. Those things people aren't doing, and that's not anecdotal. That's been established that is happening right now. In manufacturing, we use the term pig through the snake. I think we're going to see that pig through the snake at some point. I don't know when. You guys are the doctors, not me. I'm just a dummy from Foster. But we're going to have a health crisis outside of this. That is, those folks who have put off, out of fear or whatever reason, getting those regular checkups, getting those screenings, doing the things that we really hammer into people's heads with, Colon Cancer Awareness Month and all of the things we do. And when I say we, I mean all of us. I do see a healthcare crisis. We all know folks who work in healthcare right now, and they're struggling. It's not just that CNAs are leaving and that nurses are leaving. It's that the folks who make sure there are gauze pads on the shelves and that the oxygen is working and that the floors are clean and that the food gets delivered and that all of those folks, the supply chain folks, they're leaving because, frankly, they're not licensed professionals. They can go somewhere else. CNAs are leaving to go to McDonald's because McDonald's is paying $17 an hour. We can't compete with that. That's a reality that we're all dealing with, everybody, policymakers and you guys too. So I believe we are in a double health crisis right now, and I think it's only going to get worse. I don't like the idea of this get the vaccine or you're fired in healthcare. I know why you're doing it. I get it. I think we should consider natural immunity in part of that mix so that we don't realize a pig through the snake at some point, which is inevitable. But I know I'm not going to change your mind on that. Are we prepared for what is going to happen when it comes to a rash of otherwise preventable cancers and other illnesses? Are we prepared for that?
Yeah, so there were a few points that you made. One is the natural immunity piece. If that worked, it would certainly be something we would offer. We just have the data that shows natural immunity alone is not effective in what we're seeing with this Delta strain because of how transmissible it is, because of how rapidly the strain increased and became predominant based on the data that we showed. The majority of people who have had previous infections had a strain that was different from Delta strain, and so that natural immunity is not enough to protect against it in the way that the COVID vaccine could. And even still, the vaccine is necessary to help minimize reinfections, as we showed from the data. So that is why we did not, even though, understanding your desire to use if that worked, we would, but it wouldn't. What's helpful is that we are starting with, even in advance of October 1st, 87% of our healthcare workforce vaccinated, and the majority of healthcare employers saying they will be compliant by October 1st. So knowing that we are achieving that first part of our goal, which is to ensure the safest healthcare setting possible protected against COVID, is critical. We also are taking into account and very concerned about maintaining the second goal of sustaining high quality care across a stable healthcare system. And the point that you mentioned is a critical one that we have recognized because of staffing crises nationally, and because of just the fatigue and everything that is going on. What our healthcare systems are dealing with in being maxed is a situation that COVID is just one piece to it. We haven't even really begun the flu season yet. There are other viruses. There's the behavioral health crises that are occurring. What we are doing is all the more reason why every one of the prevention strategies we've talked about is critical. Simply wearing a mask makes a difference in helping to protect our healthcare system capacity and to make sure that your loved ones can go in to get cancer treatment or some emergent surgery they have or whatever other care is critical that may not even have to do with COVID. We also know people have delayed their treatment and need to be able to access the hospital setting. So wearing a mask, taking advantage of our testing as often as possible, everybody getting vaccinated, making sure ventilation is set up in all of our businesses. We can all play our part in ensuring that we keep our healthcare system as protected and stabilized as possible by doing these very simple public health tools that will make a difference for COVID, for flu, for respiratory syncytial virus, for any of the other viruses that are there, and make it so that all of our loved ones who we want to be able to have the care, if they have a heart attack or something else, can get to the hospital and receive that care in a high quality format within a stabilized healthcare system. So those prevention strategies that you are pushing and that we're really saying have to be fully compliant with in our school communities and our businesses, vaccinations, testing, indoor masking, and ventilation. Remembering those four, applying them in your business settings, making sure parents are making sure it's working effectively in all their school settings. In any place that we go to, that's what's going to make a difference in ensuring that our healthcare systems are able to provide the high quality care for those that need it.